Welcome to a Medical Moment webisode. I'm here with Dr. Brandeis of Pacific Urology in the San Francisco area. Dr. Brandeis is a bit of a superstar in the medical world. He was actually just featured on Ben Greenfield's podcast where he spoke on the best sexual biohacks and more, which actually made it to the #1 top spot on the iTunes podcast charts, which is pretty spectacular. And he was also featured on the doctor's daytime talk show. So, doctor, how are you doing?
Oh, I'm doing great. It's good to talk to you, Adrian.
Likewise, we're really glad to have you on board. And today we're going to talk about Peyronie's disease. So we're excited about that. I mean, what exactly is, for those that don't know, what is Peyronie's disease?
Right. So Peyronie's disease is curvature of the penis. So it usually is caused by some sort of trauma or some sort of infection, but 80% of the time we don't even know what actually causes it. Our patients can't remember a specific episode where that caused it. So patients can't remember a specific episode or something that caused it. But sometimes it could either be like a fractured penis. People are having rough intercourse and they hear something snap, or they hear something pop, or they experience some pain, the erection goes away, and then 3 to 6 months later, the erections are curved.
So you can actually hear the noise. I didn't know that.
Yeah, in certain circumstances, you can actually hear a pop or a click, feel excruciating pain, and the penis gets black and blue after that.
That's gotta be a scary sound.
It's a scary sound.
I heard that, actually I read it somewhere. I think sometimes horseback riding as well and cycling can also be some causes, but we never really know. Just, I guess it's high trauma to the area.
Yeah, exactly. Horseback riding, cycling, anything that potentially traumatizes or is a repetitive injury to the urethra or the penis or any of those nerves or blood vessels potentially can cause it. But like I said, 80% of the time, people don't actually say, this is actually what caused it.
And then once you get it, right? So once that thing happens, can it worsen if it doesn't get treated? Like, does it worsen over time?
Yeah, typically it will, initially it'll be painful and it'll be very surprising. Sometimes it comes on gradually. Sometimes it comes on relatively rapidly over a week or two. And then it'll plateau. And then usually the pain goes away, but the curvature typically doesn't go away. And patients can be curved 45 degrees or even more. I've seen curvatures almost 60 degrees where patients can't no longer have normal intercourse because the penis is so curved it's painful for them, or they have trouble penetrating their partner, or it's painful for their partner. So in terms of physical intimacy, it makes physical intimacy very difficult.
That's actually something I was going to ask you. Is it how or if it could affect intimacy? So, I mean.
Absolutely. I mean, obviously it's disconcerting to see your penis curved to begin with.
Yeah.
And the pain. And a lot of times, the problem is that the scar tissue causes penile shortening. So penile tissue on the inside is very unique in the body in that it's very strong. It's able to withstand very high blood pressures, but it stretches. Scar tissue is very strong, but it doesn't stretch. And so it's very disconcerting to patients because they lose penile length and they lose the ability to create physical intimacy. And also it's a contributor to erectile dysfunction. So, and it occurs in men really of any age. I mean, I've had guys in their 20s or 30s or 40s. And so here you're a 35-year-old guy, you're a mountain biker, you have a crash or something like that. And all of a sudden you wake up a couple of weeks later with a curve in your penis and you have difficulty getting an erection and you can't be physically intimate with your partner anymore. And so it's, at 35 years old, that's horrible.
Yeah. So what I know there are multiple kinds of treatment, right, for Peyronie's. Can you talk a little bit about those?
Yeah. So, the treatment of Peyronie's has been, for the most part, fairly unsuccessful. There really has never been an oral medication that's been shown to work. People have tried vitamin E, people have tried verapamil, people have tried a medication called Trentol. Nothing seems to work. And then there are other transdermal things, so things that you can actually put on the penis, like verapamil or L-carnitine. Nothing seems to work along those lines. And then a couple of years ago, they used what's called a collagenase, something called Xiaflex. And a collagenase is an enzyme that dissolves clot. And so in this situation, what you do is you numb up the penis, and then you take a long, thin needle and inject collagenase into the penis, into the plaque.
Mm-hmm.
So first of all, I mean, who wants to inject something directly into their penis? Second of all, the collagenase is an enzyme that basically eats away at the plaque. And so it creates an instability in the structural tissue of the penis. And so those patients actually have a higher risk of a penile fracture. And so even if it's successful, there's a risk of penile fracture. It doesn't really generate any increased length of the penis, and it's prohibitively expensive. So each injection is about $4,000.
Wow.
And typically patients need anywhere from 4 to 8 injections.
Wow.
So it's very difficult to get insurance companies to pay for that. And you know, it's relatively unpleasant for patients. Now, the other thing that we would do is surgery, right?
Mm-hmm.
So one thing you can do is called application. So if you have a penis that's curved, what you can do, since this side is shortened, you can shorten the other side. So it straightens it out, but basically you lose length. And so patients are very unhappy after that kind of operation, unfortunately.
Right.
The other thing that we would try to do is to create an incision in the scar tissue and then lay a graft in there.
Okay.
But those grafts still don't stretch like normal tissue. And so I used to do a fair number of those surgeries, but you know, in the end, a lot of patients were very unsatisfied. And I was looking for something else besides a flesh-eating enzyme and besides a surgery that's going to shorten the penis that's going to help. And shockwave therapy really came at the right time. It's a fantastic technology. What it is when you look under the microscope at a scar tissue, right, the collagen, which makes up the scar, looks like this, right?
Mm-hmm.
Collagen is supposed to look like this. And so when you stretch it, the fibers move alongside of each other. And so when it contracts, when it increases in size, it looks like this. But when you have scar tissue and you try to open up the scar tissue to expand the tissue, it's locked down. And so with shockwave therapy, what we do is we blast the scar tissue and loosen it up. And what I tell my patients is it's kind of like, you ever chew that old bazooka gum, Adrian?
Yes, yeah. It brings back memories.
You know, it comes back. When I was a kid, it would come in this little package, and there was a little cartoon on the inside. I don't know if they still have a cartoon on the inside. So, but you open it up, and it's, you know, it's really firm. And sometimes when you examine patients with Peyronie's disease, and you feel that plaque, it feels like a piece of bazooka gum under the skin. It's really that firm. And so what we do is we shock using the GAINSWave shock waves.
Mm-hmm.
We break up the scar tissue. We break the links between the collagen. Now, the key part of this is if you take that piece of chewed up bubble gum and stick it under the desk, like you probably never did.
No, never.
Some people actually do. You stick it under the desk and you come back, you know, in a couple of days, what's it like? It's hard again, right?
Right.
So if you just blast the scar tissue, you're not going to get much of a result. But what you actually end up doing is you blast the scar tissue and then you use a penile pump, right? And I have my patients use it at least 3 times a day, just for a couple of minutes. But what you want to do is after you break up that scar tissue, you want to stretch it, okay? And by stretching it, you regain some of that penile length and you remove some of that curvature. And things are never going to be like they were when you were 18 years old. But I've gotten many, many, many men back to functioning somewhat normally.
How many, that's awesome. How many patients would you say you've used the shockwave treatment on, or shockwave therapy for Peyronie's?
I'd say about 25 or 30 patients.
Okay. And you use it for, I'm assuming, all the other benefits that come from it.
Yeah, so we treat patients for erectile dysfunction and Peyronie's pretty much at the same time, because the other thing you want is, you know, a strong increase in blood flow, because that also is going to help improve the curvature. And
That's
so these
great.
patients get improved erections, or improved erectile firmness, but also the Peyronie's disease, gets better. Now, as opposed to the GAINSWave shockwave therapy, where typically we start with 6 treatments, for a Peyronie's disease patient, maybe mild Peyronie's disease will respond to 6 treatments.
Mm-hmm.
Mild to moderate, maybe 9 treatments. Moderate Peyronie's disease, maybe 12 treatments. I've had patients where I've had 16 to 20 treatments.
Wow.
There's not a set number of treatments that we would give to a patient and say, you're done. I'll treat patients until they feel satisfied that they've gotten the result that they want to get to. And it depends on how thick the scar tissue, it depends on how long the scar tissue's been there, and it depends on how motivated the patient is to use a suction device.
The penis pump is going to help, right? So do you often have patients that say, no, I'm not going to use the pump. I'm just not. Does that happen?
It happens, but it's one of those things where it's just a consequence of your own behavior.
Mm-hmm.
If you want to come and have me treat your Peyronie's plaque, but you're not willing to do your part, then you're not going to get the results that you're looking for. And is it really worth your time and effort? For me, it's a collaborative effort.
Mm-hmm.
I get really happy when I fix something for patients, and I get really happy. My whole team gets really excited when patients come in after 6 or 9 or 12 treatments, and they give us a hug, and they're just energized because part of their life that they've lost now has come back to them. And so that's what we're in it for. And so we really work with patients and encourage patients. And this, let's be honest. I mean, this is not easy stuff for patients to deal with, to talk about, to accept. And so part of this whole treatment, and part of what we're doing at Pacific Urology and the Pump Center, and part of what I train my staff to do, is really be empathetic to the patients, really explain to the patients that, this is just a medical problem. It's not anything to be embarrassed about. It's not anything to be upset about. It's not something to be ashamed about. These things happen. These things happen in life. It's not, you didn't do anything terrible. You're normal. We're here to help you. And so when that happens, when finally patients get that breakthrough and they're able to enjoy a part of their life that they haven't enjoyed in a long time, it really makes us happy. I mean, it really gives us a good feeling, and patients write us the most beautiful notes. And it's just a wonderful thing. And, what we really try to do is celebrate men and really honor men and create a space that men feel comfortable in, men feel confident in talking about these deeper issues, because really men want to talk about these things. They want to address these things, but there's this kind of code that you talk about it. You have to be tough. You have to be, it's not good to be sensitive.
Right.
But when you actually can get through that wall and open people up and really figure out what makes people tick and get people to talk about what their goals in life in that respect are, really it's a great place to be with a patient. And the Peyronie's disease patients are all about that. It's hard for people to accept that part of their life is sort of a little broken. And it's really wonderful to be able to help patients in that respect. If you're 35 years old or 40 years old and you can't make love to your wife anymore, or your girlfriend, or your boyfriend, whoever,
Mm-hmm.
It is a miracle when you can help someone restore that part of their life. And I mean, let's be honest, the size of the penis is a big deal for guys. I mean, guys undergo surgeries to get their penis lengthened, and I wouldn't recommend that because it's a sham. And so don't take it that I'm condoning that in any way, shape, or form. Some total disasters from that. But that's a big part of the male identity. And when you lose that because of scar tissue, it for a lot of guys, it's catastrophic. Catastrophic for their ego, catastrophic for their sense of self. And so, the beautiful thing about GAINSWave, it's not painful. You can go to the gym right afterwards. It's not like surgery or getting shots in the penis. If you get Xiaflex, you can't have sex for a couple weeks, if not longer. With GAINSWave, you can have sex at night. I mean, how great a difference in treatment is that? So I had this one patient who was a really funny guy. He came in, he was really motivated to get treatment. A lot of these Peyronie's patients are like, once they make the decision, they're like, can you treat me today? And so we just had a little gap in our schedule. I said, sure, we'll treat you today. So we put the numbing medication on, and he got his treatment. And I guess he didn't have his credit card or whatever. And they said, can I pay you next time? I said, sure. I said, but you have to leave your penis as collateral. But the guy was quick. At this point, it's really not worth much. So, but that's the other thing, is we really try to have fun with it.
You get to bond with them.
We really try to not to make light, not to make fun of it, but we really try to have a good sense of humor about it, and make it not so serious. For urologists for a long time, erectile dysfunction and Peyronie's disease were really two of the diagnoses that we really didn't want to see. Because for ED, patients would come in, we just give them some pills and they would leave. And for Peyronie's disease, there wasn't a whole lot we could do except for sort of disfiguring surgeries. And then Xiaflex came along, and so that was something we could do, but still it wasn't super satisfying. But with shockwave therapy, it's great. I had a patient today, he has moderate Peyronie's disease, and after 6 treatments, he said things are a little bit better, but they're not quite exactly where I want them to be. And I said, listen, I'm here for you as long as you want to keep getting treated. Eventually we'll get you to the point where you're going to be happy, and I'll be there every step of the way until we get you to the point where things are going to be good enough that you're going to be happy and you're going to be able to get back physical intimacy. That's the beautiful thing about the GAINSWave for Peyronie's disease, is eventually things are going to get better. And the other thing that we are considering, there's some pretty good data on using PRP, or what's called the P-shot, to inject PRP directly into the plaque. And so there's some pretty good data that, in addition to shockwave therapy, injection of a P-shot directly into the plaque improves the results. Exactly. And we're actually building out a website now for www.thepumpcenter.com.
The Pump Center.
Construction probably up in a couple of weeks. And if people are interested, I did a podcast with Ben Greenfield. So if you go to bengreenfieldfitness.com, and then I'll be on the Doctor's TV show probably in about a month.
Absolutely. And what I'll do for anybody tuning in right now, I'm going to add the link to the podcast so you can connect directly, from wherever you're watching this video. You'll be able to shoot on over to that #1 podcast with Dr. Brandeis and Ben Greenfield, where they spoke about the best sexual biohacks. I mean, that title right there just says it all.
Yeah, exactly.
All right, Doctor, anything else you want to leave the audience with?
Adrian, I really appreciate this opportunity to talk to you today. And I just want to tell patients that basically Peyronie's disease is scar tissue, and erectile dysfunction is basically blocked blood vessels. So a heart attack is basically blocked blood vessels, and no one would ever be embarrassed to go to the cardiologist. You shouldn't be embarrassed to go to the urologist. These things happen the same way you block blood vessels to your heart, you block blood vessels to the penis. The same way that you get scar tissue in your back or your legs or your knees, people get scar tissue in the penis. And the beautiful thing is, with GAINSWave, there's now a way to treat this in a non-invasive, non-painful, highly effective way. And so really, you should search out your GAINSWave provider. We're all over the country now, and we're all trained to a very high level, and where everyone's out there to work together to help patients get back their quality of life.